I have two parents who are physicians. So my father is a retired internist and my mother's a retired pediatrician. And I also have an older sister who's an ophthalmologist. So it's kind of around the dinner table growing up, that's what the business was. The first thing that we started doing was asking our staff, our nurses, our surgeons, our anesthesiologists about how safe they felt in their environment and how communication was. And obviously, different groups felt differently about how empowered they were. So it was really about building teams of surgical teams in terms of, it's not just a one-person show, it's really a team of caregivers that take care of a patient when they're having outpatient surgery. So it was really doing training and developing checklists to make sure that the same thing was done for every patient, timeouts, markings, all the things that most surgeons now, after a short period of time, take for granted as being a given. 10 years ago was not the given. I mean, that was new ground for our surgical arenas. And certainly the outpatient setting, people kind of had this attitude, well, it's just minor surgery. There's no such thing as minor surgery if it's you. If you're having surgery, it's surgery. I want it to be a safe environment. I want that for all my colleagues as well. So this all just kind of seemed totally natural to me. Every patient isn't a physician, but every physician someday will be a patient if they haven't been already. And so when you're the patient, you really want to make sure that everything that you could ever need to know about your problem is presented to you and in a coordinated manner. And what we try and not do is have fragmentation. So we don't want the patient to have to navigate in the most kind of vulnerable point in their life, because when you're told you have cancer, everything else melts away and you really just want someone to help you navigate through it. And that's really what we're providing, is a navigation. So instead of making the patient kind of go from specialist A to specialist B to specialist C and figure out, how do I coordinate, what time sequence do these appointments need to be, when am I going to be off from work, what can I expect? How do we help people through that process? Because we want them to see a positive outcome at the end, and we need to help them develop a pathway to it. So in their most vulnerable time, how do we become patient-centric and put the patient at the center of the medical universe instead of ourselves? And that's really the key, is arrange for that patient to have information from their surgeon, oncologist, plastic surgeon if necessary, radiation specialist. And from a medical point of view, all of us have one conversation instead of kind of exchanging emails and consult letters and trying to interpret what the patient experienced instead of just experiencing it together. It's a time investment, but the return on that is huge because it's less visits, less confusion, less over-testing. And what's been most rewarding about my work in patient safety is I know that I'm having an effect on greater than just one patient at a time, that I'm helping my colleagues have greater success, and by that I'm kind of affecting many lives and having greater consequence and greater kind of outcome by helping others do the right thing as well.